Hi, good morning. It's Dr. Denney over at Four Paws at Fulshear Veterinary Clinic, and today Maddie and I are going to be chatting a little bit about cat pain management and what cat pain can look like, what kind of medications can cause pain, what medications we use to treat pain, what conditions can cause pain, and what are some subtle cues that your cat may be giving you that he or she is hurting.
Dr. Denny, how will I know if my cat is in pain?
So cats are masters at hiding their disease. It's very subtle. I would say changes in behavior, increased vocalization, decreased vocalization, change in their meow, hiding, sleeping more, maybe not eating. Like I know with cat with oral pain, sometimes they'll eat with just one side of their mouth. Or you might notice that they're dropping kibble out of their mouth, like something, and that usually is a sign of dental pain. Not wanting to move, aggression. So cats can definitely, if something's hurting and you pick them up, they may lash out at you. They may hiss or swat at you. They may, like if they usually play with a housemate, and then all of a sudden you're noticing that they're attacking their housemate, or if their housemate's trying to play with them and they're acting in unusual ways, those can be signs that a cat is in pain. So like I said, it's going to be a multitude of subtle things, but what I would tell you is if you know your cat's normal behavior, and you should, it's your cat, you've had them since however long, anything that's a change, they're telling you that something's not right. Because remember, they can't talk, so we have to rely on their behavior to tell us when they're not feeling well.
Why is it important to avoid self-diagnosing pain in my cat?
So I would say that it's not as much self-diagnosing, it's not noticing that your cat's hurting because the changes are so subtle. For instance, I have an older kitty cat and he just was sleeping more than normal, but he sleeps with me every night. And I'm gonna tell you, one of the subtle things that I picked up on was he stopped sleeping with me at night. And I was like, oh, is it because it hurts to jump up on the bed? And I started watching, and sure enough, when he would try to get up to the top of the cat tree, instead of jumping all the way up like he used to, he would go level to level to level, and not jumping, he's stepping. Or when he jumps down off of something, he's stepping down off of things. And instead of one fluid moment, sometimes he hesitates. He hesitates jumping up, hesitates jumping down. That was him telling me that he was hurting. But the biggest thing is, what if you're wrong? Like, what if what if you're not right? What if you are picking up on something and you think that it's dental pain, but it's really pain from another source? And if you don't bring them in, it can get worse. And what if it gets so bad that it's something that we can't treat? So I think the biggest thing for me to impart to you is picking up on what are your cat's normals. And if we are deviating from that pattern, deviating from those behaviors, then we know that you need to go ahead and make an appointment and get them seen by a veterinarian.
What are some conditions that can cause cat pain, and what are the treatments?
So anything that's going wrong, right? An ear infection, dental disease, a tumor, stomach upset, kidney disease, a urinary tract infection, fractures, sprains. Why don't we kind of take that mirror and look at yourself and say, well, what is something that causes you pain? Because cats are living organisms. We all have, they may be different parts, like they have, paws instead of hands, but the principles are still the same. You can have pain anywhere, and so can your cat. You can have pain caused by anything, and so can your cat. So I would say that, conditions that cause us pain are obviously going to cause them pain as well. They're better at hiding their pain. Cats are predators, so we have to remember that out in the wild, and they're not as domesticated as dogs. Cats were domesticated much later than dogs. What that means though is that predator nature, they're taught to hide their illnesses, because in the wild, going back to like lions and tigers, oh my, you can't show weaknesses, because then you're going to get picked off from another predator, or you're going to lose your prey or lose your meal. So cats, that's why they're so good at hiding their diseases. It's ingrained in them. It's instinctual. So we have to pick up on these small characteristics, like hiding in the closet, sleeping under the bed. I think hiding for cats is probably going to be one of the most number one things that people will notice. Sometimes they won't notice eating less, but that's when drinking more or less. smaller urine clumps or bigger pee clumps, going into the litter box multiple times. You know, if your cat is going in the litter box every 5 minutes and straining, but nothing's coming out, that's a problem, and you need to get into a veterinarian. Cats, male cats in particular, can actually get an obstruction or a blockage in their urethra or in their penises, and they can't urinate, and that's a medical emergency. But the symptoms are going to be subtle. So you want to make sure that you're paying attention to this, because when they do get a urinary obstruction, you have limited time to get them to a veterinarian to get the blockage unblocked.
What types of pain medications might a veterinarian prescribe for my cat?
So it's going to depend on the type of pain that's going on. If we have stomach pain, then, you know, so anything with the GI tract, we're not going to reach for a non-steroidal anti-inflammatory. So it's not going to be like in humans, which in humans you really shouldn't be taking Tylenol or ibuprofen or Advil anyways if you have an upset stomach, because it can make it worse. But in cats, it's the same thing. I'm not going to give an anti-inflammatory if we're having vomiting or diarrhea. I'm going to use a different type of pain medication. And it's going to depend on the type of pain. Like acute pain, we're going to use injectable pain medication like buprenorphine. That can also be given onto the gums. Sometimes we can give a liquid pain medication called gabapentin, which is good for nerve pain or post-surgical pain. So there's going to be different types of pain therapies for cats than there are for humans. But that's just going to give you kind of a brief overview.
What is the most important consideration when it comes to cat pain management?
That we're looking for improvements in the behavior. So if I have a cat that is super sensitive around the hind end, maybe has some back pain, isn't wanting to jump, is biting the owner when they're doing their little butt rubs, and everyone that has cats, most cats, when you get you hit the butt button and their butt goes whoop, you know, they like that. That's, you know, I know all 4 of my cats love their butts, like their little right in front of the tail scratched. I call it their little butt button, and it's funny when I'm doing exams, I'm like, oh, their butt button works. But there can be pain there can be nerve pain. And so I had a patient in not too long ago that when the owners were petting down there, the cat was getting upset and hissing and swatting and running away because it hurt. So when I sent home a medication called gabapentin, dosed correctly for a cat, because they're dosed completely differently than humans, I'm looking for an improvement in that behavior. And sure enough, after a little bit of time on that medication, the cat's now back to enjoying its butt scratches. So it's, you know, we're looking to see if things are improving. That's what's going to tell us that we're doing better. If we are dropping food and we think we have dental pain, and so we do a dental procedure and we find all these infected teeth and we remove them, once everything's healed up, I want to see that their eating habits are back to normal. I want to see that they're moving around back to normal. You know, if we diagnose osteoarthritis in cats, which there's been some studies that cats that are like 9 or 10 years old, 70% of them have arthritis that's going undetected and undiagnosed. And that's not just on us, it's on the owners too, because these symptoms are so subtle. But there's an injection now called Silencia that you can give once a month that blocks osteoarthritis pain in cats. And I'm doing this right now on my cat. The changes are amazing. He's back to sleeping with me. He's jumping on and off of things. He's back to playing with his brother. So I know the pain therapy that I'm doing is working because his mobility is improving. He is back to doing the behaviors that he used to when he was younger. So that's what we're looking for. We want to make sure that what we're doing is effective. Are we seeing the behaviors that we know our cat used to love coming back? So I hope this helped answer some of those questions. If you have further questions, please give the practice a call. Thank you.